In this video, I'm going to compare a Medicare Advantage plan versus a Medicare supplement plan. I find that a lot of people, after they attend the webinar, or even if you've already been enrolled in Medicare and you already have a plan, it's still something where you might need a little refresher course, maybe a little nutshell overview, and that's exactly what I'm going to do today. So let me share my screen, and I have took the liberty to list out the characteristics under each plan. And I find that this is the easiest way to explain it, is to side by side compare these plans. And you'll see that there are some polar opposite characteristics, but then there might be some characteristics that really resonate with you. And I urge you to just hang with me for the next 10 minutes because you really want to get this right. There are some people, some folks out there that maybe started with one plan and want to get with another plan, but it's either out of enrollment period or you may not qualify. So this is extremely important to get it right, and I'm going to help you do that right now. So the one common denominator I didn't list, but if I could at the very bottom, it would be your Part B premium. Part B as in boy. In the time of this video, it's 2025. Your Part B premium is $185. Either route you take, and you cannot take both, okay? Either route you take, the common denominator is Part B 185. That's your pay to play. That's welcome to Medicare. Every American pays at least 185. So let's start on the left side. Medicare Advantage is also known as a Part C plan. It's also known as a managed care plan. It comes in the flavor of an HMO or a PPO. And I'll stop right here and say you have been on a managed care plan more than likely your entire life. Meaning, if you're on group insurance right now, it probably comes in the form of a PPO. You may have picked the gold one, the one that costs the most, and that's probably an HMO. Okay. And just a quick recap, HMO means that you always have to go to your primary care physician to get a referral for a specialist. And that specialist has to be within the network of the carrier. A PPO, you don't need a referral. You have in and out of network benefits. That's the only difference. Okay. Your PPO copays are going to be slightly higher than your HMO copays. And I can tell you this, that you've been on a managed care plan your entire life. So let's stop right here and make it real simple. If you have never had problems with your insurance, you don't mind getting a referral here or there. You don't mind going to your primary care doctor. You don't mind going into an office and getting a service and paying a copay, and understand that you have a max out of pocket. An annual max out of pocket usually comes in the form of $5,000, $6,000, $7,000, and that is your exposure on that plan. You don't mind that. Then a Medicare Advantage plan is probably okay for you. So let's go back. It's kind of, like I said, the flavors of an HMO or a PPO. It's no different than what you've been on your entire life. There are copays, there's deductibles, there's a max out of pocket. That's what makes up a managed care plan. It does replace, or it's also considered an alternative to original Medicare. What this means is you are essentially saying, okay, United Healthcare, okay, Cigna, okay, Aetna, okay, Blue Cross Blue Shield, I am going to take your version of Medicare. That's exactly what you're saying. Whenever you enroll in a Medicare Advantage plan, you no longer have the red, white, and blue card. Part A being hospital, Part B and B being medical. Okay, that is technically insurance. It's government insurance. Okay, it barely qualifies as an insurance. It's like the government gave you a boat with maybe a bunch of holes in it. We gotta fill these gaps. We gotta patch up this boat in two ways. Either you stick some Medicare Advantage patches on there and say, boom, here's my new boat, or you plug it with a Medicare supplement plan. These two ways are the ways to cover the gaps in the exposures of Medicare. A Medicare Advantage plan does that. Now, again, you would be replacing original Medicare in the form of a Medicare Advantage plan. Now, what does it include? It includes hospital coverage, medical coverage, dental, vision, some over-the-counter credits, and a gym membership. And in about 80% of the cases, it also includes a drug plan. So it is considered, if you will, like a one-stop shop. Okay. I've also explained it this way. It is a way that Aetna, Cigna, Humana, Devoted, Blue Cross Blue Shield, you name the carrier. There's all kinds of different, if you look on Medicare.gov, you put in your zip code, there's probably 60 to 80 Medicare Advantage plans in any given county in the United States. So how do you pick one? Well, each one of these plans has a primary focus. For an HMO plan, it may be having the lowest possible copays. For a PPO plan, it's in and out of networks. There's high dental on plans. There's Part B givebacks on plans that lower your Part B premium. If you're looking to really keep your insurance premiums low, you might want to go with a Medicare Advantage plan. But understand, in the Medicare Advantage world, you cannot have your cake and eat it too. Okay. You cannot have a plan that doesn't ask you for prior authorizations. Okay. Prior authorizations are whoa, 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 whoa. Judy, are you saying that in order to go get this really expensive cardio test that your cardiologist recommended, we need to hear from him again that you actually need this. Please hold. Okay. And they'll make you wait. And what the company is doing, the carrier is doing, they need to contact your cardiologist, say, show us evidence that Judy needs this expensive test. Okay. So there is an extra step. Now, these plans are doing really good in approving most of the prior authorizations, but it's a possibility. That's what I'm here to tell you, that it can happen on a Medicare Advantage plan. Now, all of these benefits are included, and what the company wants you to do is saying, hey, don't worry about what original Medicare does not give you, like dental, like vision. We're gonna keep you a happy camper on our plan by giving you all these benefits. And it comes at the whopping price tag of $0. You can see why a lot of marketing, both the mail that comes to your mailbox, the TVs, the commercials that are on your TVs, the robocalls, they will always float you these fluffy benefits because it sounds nice. It encourages the call. Okay. I'm not against it. I'm not against either one of these plans, but I'm against someone being very upset with a Medicare Advantage plan and thinking that, it should be as free as a Medicare supplement route. And we'll get to that in a little bit. Okay. So that's why it's a $0 plan. You got to bend and twist with the insurance company if they're going to give you all of this for $0 a month. Okay. It's considered a pay as you go plan. So you're not paying anything per month in most cases, most plans in America. It's a $0 plan. So it's pay as you go. Anything from a specialist and beyond, most primary care, $0. You see a specialist though, maybe $40. Okay, you go get an MRI, maybe $250. You stay overnight at the hospital, 1 day, 2 day, 5 days, could be up to $2,000 out of pocket. So it's pay as you go. So it is, I'll pause right here. It is highly encouraged. I never recommend a Medicare Advantage plan without some kind of backup plan, an umbrella plan, call it what you want it, meaning there's 4 ways you can really hit your max out of pocket, $5,000, $6,000, $7,000 out of pocket in a year. Cancer, heart attack, stroke, hospital indemnity. Those are the main things. So it's important to have a backup plan. And if you don't have one, reply to this video and we can go over that. But it is essentially an indemnity. It's a private plan that, yes, requires a little bit of premium. Some places anywhere as low as $40 to as high as $80 or $90 a month. that will provide you a benefit to help you pay those higher out-of-pocket copays in those particular scenarios. Because name a way that you hit $5 and $6 and $7,000 out of pocket with copays of anywhere between 80 to 40, 80, 250, 350. Well, it's multiple events of those higher out-of-pocket costs, which are going to be critical illness, cancer, heart attack, stroke, or a hospitalization. Okay. So I've hit that one. Let's go to a Medicare supplement. Medicare supplement is also known as a Medigap plan. There are no networks because you have original Medicare as your primary insurance, and original Medicare has no networks. You throw a stone in America, you'll hit 96% of doctors that accept original Medicare as your primary insurance. There is a small $257 annual deductible to hit with this route. After that, there are no copays, deductibles, or max out of pockets, and that's mainly with the Plan G. With the Plan N, you got two little small copays: an office visit of $20 and an ER visit of $50. Okay. After that, 100% coverage medically with a Medicare supplement plan, G or N, as your secondary insurance. And there is premium to this. 100% premium to this. If you're going to hire an insurance to be your secondary plan and say, hey, I'll need you to plug the gaps on anything that my original Medicare Part A and Part B doesn't cover, and plug it good, well, they're going to charge you a premium every month. Plan N in some states are as low as $80. Plan G's in some states, and this is for a 65-year-old, 65 to about 68, anywhere between $130 to $140 a month. So you'll have original Medicare plus your secondary. And this, as you can see, we're kind of building this a la carte because we're building off of our primary coverage, which is original Medicare. Well, there's gaps in there. So what do we add? A secondary. Well, original Medicare also does not cover prescription drugs that you get at the pharmacy. So we're having to add a drug plan. Okay, and there's some premium to that. I've seen $0, $20, $40, $90, $120 drug plans. It all depends on what medications you take. Next one. If dental and vision is meaningful to you, then you'll need to add it here because primary insurance, original Medicare, does not cover dental or vision work. All right. So instead of pay as you go, like it was over here on the left side, it is now pay monthly. But you are paying monthly. And I would say in a good year for Judy, she's paying monthly and knows exactly what's coming out of pocket every year, knows exactly what she's going to spend on her health every year. In a bad year for Judy, she's going to have her monthly premiums plus that deductible. Okay, if she goes with a plan in, maybe a handful of doctor visits in a year, but it's still predictable. This side is very predictable. Medicare supplement is black and white insurance. That's what I call it. There's hardly any gray areas. Okay, there are no prior authorizations on this area. So very plainly, if I can put it to you this way, a Medicare supplement plan is going to be, if I'm walking onto a car lot, okay, and I'm walking with my red, white, and blue card, and they let me in the car lot. And on the left side, there's the Medicare Advantage Chevy Silverados, okay? And on the right side, there are the Medicare Supplement Denali XLs. Both are going to get you to where you need to go, okay? One is just more per month, okay? And you'll pay more per month for your Denali XL. However, it's exactly customized how you want it, okay? Going to get you from A to B, just like your Chevy Silverado. It just doesn't have it may be customized exactly the way you want it, but you're okay with that. You're okay with a Chevy Medicare Advantage plan, so to speak. You're okay to bend and twist a little bit. And it's a good way to keep your premiums low every month, month to month. So I really hope that this video helps. I have no other way. I've been thinking about like comparing it or how to build a burger or things like that. But to keep it very simple, again, remember Medicare Advantage is a managed care plan. You've been on it your entire life. Okay. If you're okay and understand the insurance, they got co-pays, they got deductibles. Sometimes you got to, provide evidence to the insurance company. Then that's a Medicare Advantage plan. If you don't want to bend and twist for the insurance company, then there will be a little bit of premium for that freedom. And you'll go with a Medicare supplement. So hope that helps. Reply to this video if you need any help comparing plans in your area. Take care.